monitored, and we may end up with diabetes or all kinds of different things. And we might, in our society, you're lucky here because you've got one place that's managing things for you, but we might go to a lot of different providers, and they may not know what everybody else is prescribing. Also, pain can increase as we age, and obviously we all want to get out of pain. I was impressed to hear you have an acupuncturist here. We see a lot of folks that can be helpful for, not for everyone, but sleep problems increase as we age, and we want to take care of them. Who doesn't want to feel decent, you know? And sometimes those little pills and that little drink can really help us feel good. Also, they say that as we age, we're probably the worst in medication compliance, which surprises me, because usually we're more responsible. But some of that could be as we're really getting older and older, not less the boomers and 60s and 70s, and some of that could be because of vision. I can't quite see what's right on my pill. I'm not really trying to be an addict. I just got mixed up a little bit because I can't see it. I can't open the bottles, so I might not try that pill today because it's just too hard. I couldn't get the bottle open. Also, handling those little pills, you know, and dropping a few can be a concern. Could be mental confusion. I know some people that, you know, it's really helpful. Somebody doles out their pills just to have it ready for them and stuff, but then we're talking older. Also, not drinking enough water. You know, when we do take our meds, we need to, obviously, and you've all heard this a million times, make sure you get your water in. So I've got a slide here with medical concerns, and are these medical concerns or are they substance misuse? So the last time you saw someone shaking a little bit, where did your head go? Probably Parkinson's. Ever think about it? It might be withdrawal. That's a sign of withdrawal. Or the last time you heard about a broken hip, where did your head go? A fall, rightly so. But did your head go to, well, maybe they took a sleeping pill before they went to bed, got up in the middle of the night, and were a little woozy and fell. I mean, it can get really complicated, and I'm not saying any of these are substance abuse, but I would encourage you just to take the opportunity to at least question, is this related? Why can't I get my diabetes regulated? Well, is it those drinks I'm having every day that are throwing my sugar off or whatever? And it's really difficult to diagnose as we get older. For one thing, most of us don't have as many objective measures. So if we want to sleep in the morning, probably not going to get fired because of it. The structure in life is a little bit less. You know, we can kind of choose our own structure. Probably, especially here, you're probably not getting DUIs, you know, or you hire somebody to drive you if that's a concern. Family may not be around to notice it. So family comes in once a year and spends a week. Do they really see what's going on? You know, going from place to place can be, well, who really knows what's going on? You know, sometimes it's the apartment manager or the housekeeper that knows a lot more what's really going on than the family, you know. Also, I've known of families where, you know, daughter calls every day and speaks to mom, but daughter calls at noon. When does mom start drinking? You know, so all of a sudden daughter's just shocked, like this is not my mom, and you know, and then yet another daughter's talking, and so families really struggle with how do I identify this, but also how do I talk about it, and we'll talk about that a little bit also. When we're looking at people with problems, we're looking at two different types of groups. One is what we would call an early onset addict, and those are the folks who probably have had a problem most of their life, on and off maybe. They may be lucky to be alive if they've continued to drink and use drugs most of their life. But they may also have had a problem when they were in college or young adulthood, and you know, were so career driven that by God they put the chemicals down and the alcohol down or really moderated it, and were able to do that for many years until their metabolism kicked in on them. Or I've known people, we've had people in treatment, high functioning people, got sober many years ago, good lives, good everything, good careers, And all of a sudden they're, 20, 30 years sober, 20, 30 years sober, and they have hip surgery or some type of surgery, and they get back on the pain pills. And it just really escalates into obviously adding the alcohol back in and stuff. So we see a lot of folks where the pain pills can be really concerning for them. So early onset addicts are usually men, because the culture years ago was men could drink, but women didn't drink a lot, and although they did, but it was more invisible. Usually men, and usually these folks are maybe probably in the criminal justice system. They're probably a little more impulsive, folks that might be getting in trouble. Here's what we see a lot of, and this is late onset addiction. These are the folks that have been highly functional throughout life, lots of good coping skills. Recently I was doing an outpatient group at our site in Naples, and there was a man who came in and he was brand new in the group. So he kind of told a little bit of his story, just a little bit, and he'd ran 4 companies and he was big in philanthropy. And then he said this, quote unquote, "I'm 61 years old and I have no idea what I'm doing in a place like this." This is a late onset addict, someone who is very, very functional, and all of a sudden something changed, and that alcohol turned on him. We do see a lot more women in this group than men, and a lot of times we have to look at what are the losses they've experienced, that weighs heavily. Yes, it may be that they have a genetic risk, but it also could be losses, it could be lifestyle. As those of you who come down here, social hours, social things are very important. And please hear, at Hazelden Betty Ford, we are not a temperance society at all. We believe a lot of people can drink and do drink, and more power to them. But the people where it becomes a problem, that's where we want to be there to support and to help them. We do see less cognitive damage. These folks are more likely to get into recovery and stay in recovery. The hope, not that the hope isn't there for the early onset addict too, but the hope is really there. Partly because they're more receptive. They've had lives, they want to get back to having lives. You say, so okay, Brenda, you say this is really hard to diagnose, and how do you do it? And here, this slide is really made more for clinicians with different tools that can be helpful. But the one I would point out to you is what we call the CAGE, and it's very simple. And it's C-A-G-E, and it's one you can, I probably wouldn't ask my best friend, one day, this kind of thing, but these are kind of some questions that you can frame in your mind. Have you ever cut down, the C is cut down, or controlled your drinking? Normal people don't think a lot about it. They just kind of do it, cut down or control. This is not diagnostic, but it's a really good screen. A lot of docs' offices use it and stuff. Do you find that others are annoyed by your drinking? And that can be, think about it. Is the housekeeper annoyed that she's always got to haul out all these bottles and hide them so that your neighbors don't know her? Or I don't know, who are you annoying with your drinking, The G is, do you feel guilty about your drinking? Or drugging? Do you feel guilty about all those pain pills or all those benzo pills or whatever, or the sneaking and the hiding? Do you feel guilty about that? And that's an internal question for people to answer. And then the E is the eye opener, or early, I would add. Do you find that you need a little bit something in the morning, a hair of the dog that bit you to help you a little bit? Or a little bit something a little earlier than you're used to. Your friends are going to social hour at 4, but you've started at 2 so that you can feel good to be at social hour at 4. So, physical signs and symptoms, you can see there's a lot of them. This does not mean people are addicts, but I'd ask you just to look at, if someone's mixing up their appointments, is it cognitive difficulties, or is it, get a little foggy adding all those pills together? Behavioral pieces, one of the pieces I want to point out here is what we call nesting. One of the things about recovery is as people get in recovery, life gets bigger again. But as people move into addiction or chemical use problems, life gets real small. And nesting is a term that we use with people as we get older. All of us, probably in this room, most of us, have a chair. And by our chair is our favorite book or our remote or whatever and stuff, But with addiction, the world gets even smaller. So by that chair, the person may not want to go out as much because I can sit in my chair and I can read and I can drink. And I can drink more and you're not going to bug me about it. And I don't have to worry about driving. Or I can sit in my chair and I can have both of my glasses there. You know, the ones I use for reading and then the glass I use for drinking. Or I can sit in my chair and I can nod off. And nobody's going to bug me because of mixing all those pills, it gets kind of wobbly at times. So just looking at, you know, if you see people their world starting to close in, it could be because of aging, could be because of depression, but it could also be because of substance use. And then as we age, we're all much more vulnerable to emotional concerns. And what we found with people with chemical use, abuse, and addictions is we thought we would find grief was the number one issue, which it is an issue, huge losses for folks. But we found a lot of shame with this population and a lot of loss of purpose. And when we're talking about the baby boomers, we don't see so much loss of purpose because a lot of them have struggled with ever having a purpose. But when we're talking about older adults, we see people that feel like they've lost their purpose. We also, one of the guys in treatment who was an exec in a big company, he talked about being a formerly important person. He said, this has been really difficult for me because everybody used to want to know my opinion and everybody used to ask my opinion and now nobody's asking. And as a mom, as a grandma, as a worker, as a whatever, you know, who are you important to? And that can be a huge grief loss for people. We see a lot of folks that are accidental addicts. They had no intention of becoming addicts. But because their metabolism slowed down and their kidneys and their liver didn't get rid of the poisons this quick, and they had a few losses and they might have had some pain and they're taking multiple medications, all of a sudden they're alcoholics. They could also be addicts because they mixed up the blue pills and the green pills, because as we all age, we have yellowing of the lens, some more severe. So we might be mixing up our pills and our colors, or we may be taking the wrong dose or something. So that it can get pretty crazy for folks and pretty quick too. So that's why families sometimes will say, "Not my mom. Are you talking about my mom?" And you know, the daughter or son that's nearby says, "Yeah, that's our mom," and there's a lot of surprise. People sometimes say, "How do I talk about this?" You know, this is it's interesting. Today we went and ate at the Pink Elephant. The Pink Elephant is a term we use in the addiction world for that elephant in the middle of the room that nobody's going to talk about, you know. I mean, mom could be passed out, but nobody's going to talk about it. Why she passed out, you know. So how do you talk about it? And I would really encourage you, especially with the older adult, and less so with the boomers, is to not use labels, not use words like alcoholic or addict, because the shame is so huge. But try to tie it to a health issue if you can. Mom, I'm worried about your diabetes. We're not getting this under control. I'm wondering if your sugar intake from the alcohol, if we could look at that or something. You know, if you can get the healthcare provider involved, that can be really, really helpful. Or you don't seem to be yourself, you know, like, can we take a look at that? One of the things that we know about families, they may either be done or they may be over-involved, but usually when there's a crisis, they get involved. And that's you with your grandkids when they're in college and all of a sudden your kids find out they're on drugs or something, the whole family's usually there. But the same thing happens as people are aging. So one of the things I do want to point out is around detoxification needs. The number one drug people die in withdrawal of is what? It's alcohol. People think it's heroin, won't die. They'll feel like they're going to die, but they won't die if it's just heroin. Alcohol is the number one drug people die in withdrawal of. The second one is benzodiazepines, the anti-anxiety drugs. So if you're using alcohol with benzos, you need to get a medical attention. It doesn't mean you have to be hospitalized, but to step yourself down. And the other piece as we age is our detox goes a little bit longer because our bodies are not getting rid of the poisons of chemicals quite as fast. And I do want to address a couple of the myths of addiction and aging. A lot of times people will say, well, just let them be. They've lived a good life and, they're happy. Well, if they cross the line into addiction, they haven't hit happy. It's pretty miserable, in fact, when you talk about things like this. I would encourage those of you who are looking for treatment options to explore the least restrictive option first. So for a lot of people, it could be education with the doc, the healthcare provider, a good screening. SBIRT is S-B-I-R-T is a great screening for us as we age, looking at might it be a problem. On the Hazelden website, there's a screening tool called About My Drinking. Actually, you can just Google aboutmydrinking.org and put in your information there. See if it says maybe there's a problem. It's anonymous. Or there's another screen that you can put in your loved one's information, so it can give you some support in that. And then, of course, there's traditional treatment options. We see a lot of folks in their 50s plus doing outpatient at our Naples site. Why? They're high functioning. They may be caregivers, so they can't go away to treatment. They may need to come home and be a caregiver to their wife or husband or whatever with MS or whatever. And they respond very well to a class type situation. Learning is real important. So we had one lady recently who talked about coming to her class. And one day I was doing her class just as a lecturer, and this lady came with her, and I said, oh, hi, are you new here? And she said, this is my driver. I want her to be in my class. Well, because we're treatment, you can't have your driver in your class and stuff. But it showed me that she was really engaged in learning. And was that the traditional model of treatment where you have to say you're alcoholic and stuff? No. But was she getting help? Absolutely, because she wanted to share it. So looking at treatment programs that can really be flexible, that it's not, we've had people come to our program who drive down from North Fort Myers. They don't like to drive very much, but they'll drive, stay overnight at a hotel in Naples, do group the next day, and then go back and not come back for a week. It's okay. What does that person need? The boomers are a little bit different. By God, and those of you who are boomers, it's different. They're going to make choices. They know that addiction can be a disease. They're going to want it their way. They're going to have used illicit drugs even now when they come into treatment. They may have 2 or 3 or 4 families. They may have been divorced several times versus the older adults. That's less likely. What we do know is the number one drug that boomers are abusing, other than alcohol, but illicit drugs, it is marijuana, with pills, the second. And that's illicit. That means they're getting them a different way, illegally. And they're going to do some research. So they're the ones that are going to say, this is what I think it is, and obviously they've already done their research. If you're looking at how can I continue to help people that might have a problem, or how can I set my children up to help me if I have a problem, talk about it. I heard this lady from Hazelden Betty Ford lecture on chemicals, and I just want you to know, if you ever get concerned about my chemical use, talk to me. And we might go to a class or whatever, or we'll talk to the doctor or whatever. People who've been in treatment, we encourage them to use their families for what if I quit going to my AA groups or my support groups, whether that's through their church or whatever. Ultimately, healthy aging's about, look at the first one on this. This is from a book called, I think it's called Healthy Aging. And one of the first things we list is addiction-free, because none of the rest can happen unless people are addiction-free. So we do have some resources. Hazelden Betty Ford has a publishing company. We've got a book on aging and addiction if you're interested in it. The middle one is more science, and then we've got a little bit on women's recovery. So anyway, my hope is that you've gotten some new information today. It's not about shame. It's just about, the perfect storm. And my hope also is that you might share some of this information with folks that you care about. So, any questions or concerns? Yes.